Hi there, my name's Jade, for all of you that don't know me, and for all of you that do, thanks for watching. Okay, so this video is going to be about my journey with jaw surgery. I had been wanting to do this for a long time because I had researched using YouTube when I first started thinking about getting it done, and I found that it was really handy, and I wanted to do the same thing for other people. Basically for people that want to have this surgery done themselves. So I'm going to include a lot of before and afters for you, so you can see before, during and after. My whole surgery was double jaw surgery, so that was my top jaw and my bottom jaw, and I also had genioplasty done. And the genioplasty I had done twice because the first time they did it, it was quite off center and crooked, like I had like a big divot in my jawline here, and it was sort of going that way, so it didn't really look very good. So my problems when I was thinking about having jaw surgery were that I had a longer top jaw and a shorter bottom jaw. My top jaw was very gummy, like I had a gummy smile, as when I smile now, like you can still see some gum, but it's a lot better than what it was before. Before it was like when I smiled, so yeah, there's a huge difference with that. And my bottom jaw, I had an overbite, so it was too far back. They broke my bottom jaw about here, and they brought that forwards, and my top jaw, they took about a wedge of bone about 4 mils out and moved that up, and they also moved it a little bit forward. Before all that, I had 4 teeth taken out, 2 from the bottom down here and 2 from the top up here, just so they could move everything back because my teeth looked really like protruding. It wasn't very nice. One thing that I wasn't sure about when I first started looking at doing this surgery was that the price. Like, I thought it would be really expensive because a lot of the people that I'd been researching, I think they might have been from the US, and there were some from Australia, and a lot of them were saying like it would cost around 20 grand, 15 to 20 grand, so I was a bit like, okay. So I saved up money, went to the dentist, and they told me to go to an orthodontist, and I went to the same orthodontist that my cousin went to because I really liked the way her smile turned out. And he basically told me that the only thing I'd have to pay for would be the braces and maybe some splints and surgery. I think I ended up paying my braces and then maybe $500, or not even that, for x-rays or something for the surgery or something maybe. But yeah, Medicare covered all of it basically, because they class it as structural. I got my braces on my birthday. I think I might have my braces on for 1.5 years maybe before I had my surgery. I had my first operation date probably in April, but I think it was cancelled about 3 times before I actually had my surgery because I was doing it in a public hospital. That's something you might have to be aware of, that if you aren't doing it privately, you might end up having your surgery dates cancelled and postponed and all that because, you know, if someone comes in from a car accident, they need to get their faces fixed first, obviously. But, you know, it'll happen. I used to not have a jawline, and now I do. Never had a chin, now I do. And I really like the way it's turned out. I would definitely do it again, that's for sure. Okay, so some tips that I would say when you have surgery, double jaw surgery, if you're going to have double jaw surgery, would be to make sure you bring a mirror. Just a pocket mirror, just something you can see where your mouth is, because you're basically going to be numb from like here all the way down to probably here. And if you can't see where your mouth is and they want you to drink water or something, you're going to try and find your lips, and you're going to end up with water all running down your chest from trying to, drink water. And it's messy. So I didn't know that, and I probably had to wait a couple of days before my sister came in and bought me a little hand mirror. And I think I might not have actually eaten for 3 days maybe. They wanted me to be on a soft food diet, and I was supposed to be on a liquid diet. The soft food diet was like mashed potatoes, that sort of thing, or pureed potatoes and vegetables, but I still couldn't eat it. Like, my teeth were shut with rubber bands, and they were really tight rubber bands, so you couldn't really open your mouth. Also, after my surgery, my bite was open at the back, so I couldn't actually chew even if I wanted to, and I didn't have the rubber bands on. So it was actually probably quite a while before I was actually able to chew properly. You can get little sachets of pureed fruit with a little sachets, and they've got like a little funnel sort of thing, and you can just push it in your mouth. It's a lot easier than trying to use a spoon, because you're not going to fit a spoon between your teeth when they're like that. It just won't happen. I found that I could put a Nutella spoon in between my teeth and was able to eat that way, but for the majority of the time it was, I think it might have been 6 weeks on a liquid diet. Boost juice was probably the best thing I could get at the time, and custard and pureed fruit. Yeah, what's going to happen is you're probably going to vomit a lot of blood. I know I did. Might be different for you, but I vomited up a lot of blood, and the first 4 days were probably the worst, and I think the 4th day was probably the worst for me. And I've heard that before from other people as well, like the 4th day is horrible, but you get past that and it becomes a lot easier after that. You don't have to worry about pain so much. Well, I didn't feel like it was very painful, but I did feel uncomfortable. The whole not being able to chew was really annoying, not being able to close your mouth properly. Yeah, I think I might have gone home from surgery, it might have been the 5th day after surgery. There was a point, I don't know if it was my 4th day was the worst, because I had the drip taken out and I wasn't able to drink water properly because I couldn't see or feel where my mouth was at the time, so I wasn't able to drink water and get enough water. But they took my drip out for some reason, and then they had to put it back in because obviously I was dehydrating. The nurse, the poor girl, she had to try and find a good place to put in a new drip, but I just remember lying there and she was just poking me around with a needle, just trying to find somewhere to put it. But because I was so dehydrated, she couldn't find it. So I think she had to call a doctor in to do it, and my care factor at the time getting needles put all through me was just 0 because I was just felt like death. It's only 5 days maybe that you feel like that, and if you don't want them to take the drip out because you feel like you're not going to be able to drink properly yet, don't let them take it out. That's all I can say, is don't let them take it out. Some people can go home earlier. I think I had to stay in for 5 days because of that reason. I was vomiting a lot, but that was mainly the blood. Like, you keep swallowing it even afterwards. A lot of people go, oh, it would be so painful, but it's really not that painful. It's more uncomfortable, and you sort of just can't wait for it to all be over so that you can just go about your normal day life again, but it takes a while. When I got home from surgery, I went and stayed with my mum for a while, probably a week I reckon it might have been. Yeah, and she looked after me. I had just pureed food still, not a lot. I lost about 6 kilos after surgery because, yeah, I just couldn't eat anything normal. It was all pureed, and you just don't feel like you don't have an appetite. Like I didn't feel like I had an appetite. I just didn't really want to eat because it might have been the anaesthetic. Like I have a big problem with anaesthetic. It makes me feel like crap, like hungover or something really bad. Worst hangover you can have, sort of thing. One thing that I should probably warn you about is what people's reactions might be afterwards. Like you might look at yourself and say, oh, I kind of don't recognise myself at the moment, but you like it. But other people like might actually say things to you like, oh, I like the old you better, and you might find people delete you off Facebook because you were posting too many pre-op and post-op photos and things like that, before and after photos. I found that the people that really are your friends will be happy for you and will like seeing photos of how you're recovering from surgery and how happy you are about it. There might be people out there that are going to say, I preferred the old you better, and you know, it doesn't really help because it's like, well, what do you want me to do with that opinion? Like, go back and change myself back to the way I was before? Because I've just gone through all that pain and suffering and being uncomfortable for you. No, you do it for yourself, and those people that you care about and that care about you will be happy for you. And the most important thing is that you're happy with the way you look and the way you feel about it. Also, sleeping is really uncomfortable and hard to do after surgeries on your face because you basically have to sleep sitting up. So I found the best way for me to sleep was to get a U-pillow, put all my pillows up behind me so I was sort of lying like that, and then I would put my U-pillow on either side of my head or around my neck like that, so that I could only move my head that much. Otherwise you'd be resting your chin on your pillow and it would, or your jaw, it would hurt. So that's a good way to keep your head still, I thought. And you do get used to it after a while, like you will be able to sleep well. And they will send you home with painkillers. I had tramadol and endone, and they both work fine for me apart from the endone. Endone I could only have when I was going to sleep because otherwise I'd feel really ill. But it really did help me sleep, so that was good. I found that I probably, after the first 7 days after surgery, I pretty well only needed to have Panadol as a pain relief for normal daytime relief. At night time I would have an endone or a tramadol or something like that, just to make it easier for me to sleep. And sometimes in the morning you might feel like you need something a bit more stronger because it's all worn off during the night and you wake up and you feel a bit sore and stiff, so you might want to have something a bit stronger in the morning and something a bit stronger at night. But if you have any other questions that you want to ask me, just comment them down below and I will definitely get back to you, because if I can help you, like, this is what the video is all about, is helping other people that might be having this surgery or are thinking about having this surgery. And I don't regret this for a second, like, at all. Like, it's, I wouldn't say, oh, it's changed my life, but I kind of feel like it has. And if it's what you want to do, go for it. If it's not what you want to do, well then don't feel pressured into doing it either. And don't feel like you're not good enough the way you are just because someone like myself or someone else has gone through it and they feel a lot better about themselves now. But like, if you already feel great the way you are and somebody suggests, like a doctor has suggested for you to do it, well, only do it if it's what you really want to do, not what anyone else wants you to do, because it's a lot to go through. So I hope I answered everyone's questions. If you actually sat through this whole video, thank you for watching.